Okay, can everybody see this? Can everybody hear me? Alrighty, I'm gonna bring this down. And so this is a presentation I have created for my capstone project for the Master of Arts in Liberal Studies program at UNC Charlotte. And I'm gonna go ahead and jump right in. Oh, here we go. So just a quick introduction. What I have done is create a advanced topics in psychology course entitled Perinatal Mental Health, which would be an evidence-based senior level undergraduate course for students in psychology and other academic disciplines such as social work, counseling, women and gender studies, child and family development, or sociology. And this course is specifically designed to introduce what perinatal mental health is and the different facets that are involved in perinatal mental health. So what I have done is provided an outline of what assignments would be involved, and there are 5 quizzes. There would be a midterm paper outline of a final term paper and a group project. And all of these assignments are meant to integrate the knowledge that the students have gained from each module of the course. And I'm gonna run through each module very briefly for you guys. In Module 1, we would be addressing what perinatal mental health is, and by doing so, we would address the significance of perinatal mental health in the population and address mental health stigma in general as it's related to culture, and then mental health stigma as it's related to society as a whole. We'll also address the parenthood myths that most people face when they become first-time parents, like having to be a perfect parent, know how to do everything at once, and then also the expectations that women and their partners may face when they're pregnant or when they become pregnant or when they give birth. So continuing, the course would begin to address more serious issues like understanding the difference between perinatal mood and anxiety disorders that are experienced during the perinatal and postpartum period, and then being able to distinguish the difference between typical mood and anxiety issues that are chronic disorders. So in perinatal disorders, we have the baby blues, depression, and bipolar. And we also see depression and bipolar disorders as chronic mood disorders. And in the perinatal period or postpartum period, we can see anxiety disorders, panic disorders, obsessive compulsive disorders, PTSD, and psychosis, which are also chronic disorders that occur in general populations without a perinatal experience. And moving into our third module, we would begin to identify at-risk populations. So we look at socioeconomic status and we explore how both women and men face these issues. Women express them and feel them differently, but likewise, men experience them as well, because just as women become first-time parents, fathers are becoming first-time parents as well. And one of the biggest limitations to this is financial resources, education, medical treatment, and mental health treatments as well. And so when we look at vulnerable populations, it's important to be able to identify if there's been a prior history of a perinatal mood and anxiety disorder, if the person has experienced any kind of complications throughout their pregnancy, and if there was a prior history of mood or anxiety disorders prior to becoming pregnancy. And then we also look at the populations that have had birth-related complications. So there we look at pregnancy loss or infant loss at birth. We look at people who have experienced abortion, early birth, traumatic births, and most interestingly, we look at the population of parents who adopt or experience infertility issues. And it's typically unknown that these parents experience some of the same symptoms that biological parents experience when they have children because of the expectations that they have set up for themselves as parents. Continuing, we start to explore more neurological and physiological aspects of perinatal related effects. So when we look at the hormone factors, we look at chemicals such as oxytocin, vasopressin, estrogen, progesterone, prolactin, and androgen, which are actually hormones that are secreted by both men and women when they have exposure to an infant. This is not something that is isolated to just women. We also began to look at the role of serotonin and dopamine and cortisol as it relates to bonding and attachment to an infant. And most importantly, we start looking at the neurological and cognitive changes that take place in the brain of mothers and fathers when they become parents. So we look at the increase or decrease of gray matter volume. We also look at the amygdala and the role that that plays in attachment, which is correlated to hormones. We look at hypothalamus and hippocampus, which is known to create neurogenesis and activate the growth of new neural networks in the brain. And then we also address changes that are experienced, such as memory, attention, vigilance, and emotional regulation issues in mothers and fathers. And one of the most important parts of this is preventative approaches. So how do we know if a woman or her husband or her partner or same-sex couples are experiencing any kind of these issues? So the most important is early detection. And in order to do so, it's the role of the primary caregiver or the OBGYN and even the Medicaid or WIC office to start looking at issues that the mother or father may be experiencing before pregnancy, during pregnancy, and after pregnancy. So Postpartum Support International actually advises that there's screening that takes place at the first perinatal appointment and each subsequent trimester of pregnancy. And then at a 6-week postpartum visit, 6 months postpartum, and 12 months postpartum, because this can actually go on for up to 3 years after a woman has given birth. And so we also would look at some of the screening tools that are the most applied in these situations, which the first is the Postpartum Depression Predictors Inventory. Then there is the Edinburgh Postnatal Depression Scale, the Postpartum Depression Screening Scale, and the Patient Health Questionnaire. And there are a few accuracy issues and barriers to these testing, which most of them are more applied for women and men that have depression-related issues, not so much anxiety, OCD, or psychosis-related issues. And finally, the course would end with looking at treatment approaches and cost versus benefits. One of the most important things that we have learned in the trainings that I have been able to attend is that unlike a physician, we see the mother and the father as the primary patient. So, of course, psychotherapeutic approaches are the first to be implemented. So we look at cognitive behavioral therapy, eye movement desensitization or desensitization and reprocessing. I hope I didn't destroy that. And then support therapy, which would involve couples therapy, support groups, mothers and father groups. And then if things of that nature do not actually help, they start to look at psychopharmacologic treatments. And there's many considerations that need to be taken into account when a doctor decides to start prescribing medications. So is the woman still pregnant? Is she in the postpartum period? If she is in the postpartum period, is she breastfeeding? And the FDA has categorized much of these medications by A, B, C, D, and X. So A pretty much means safe. X means it's not been tested or has been associated in any way, shape, or form with pregnancy or lactation. So going into it a little bit further, there would be an evaluation and differentiation of SSRIs and SNRIs as they're related to treating anxiety and depression. And then we would look at antipsychotics and mood stabilizers such as Seroquel or Abilify that would help to treat issues like psychosis or OCD. Give me 1 second. Okay, I'm sorry. And so in this course, the takeaway message would be to begin to inform the newest generation of students who would become practitioners and are interested in focusing their career in this specific area of study. I have encountered several individuals who were in graduate school focusing in postpartum depression or perinatal disorders of some sort. And a lot of the information that we received came from outside training that only practitioners and physicians were actually able to access. So I feel this would be a really great course to begin with for students who already know that they have an applied interest in perinatal mental health, specifically as it relates to postpartum depression, postpartum anxiety, postpartum OCD, or postpartum psychosis. So I think this would be a really great course that could be implemented within the university and perhaps even other universities. And as you can see now, I do want to give a special thank you to Dr. Blanchard for working with me throughout my time as a student in her program, Dr. Van Wallendale for being able to take on the responsibility of working with me, Dr. West for being my support system as an undergraduate student and the graduate student, Larry Gordine for always helping me through my my personal related issues due to being a mother and trying to balance being a student. My friend Natalia Jimenez, who lives really, really far away in Texas, but has been one of my largest supporters while I've been going to school. And then my family, which specifically my grandmother, who I promised a long time ago that I would go to school and be a doctor one day, which I'm on my way to that at some point. And then my 2 kids, which is Sean Connor and Alessandra Connor, who are obviously not watching, but they are my motivation for doing this and wanting to do a good job. So that would be it. And I want to thank everybody. If there's any questions, I can try my best to answer.
I have a question. And this is a tough one because I don't think any of us ever know. What do you think is going to be the most challenging component of this for your students?
I think if students are not well versed, which the idea, I guess, towards the second portion of the course, which is why I do have prerequisites such as biology to be one of them. If they have no previous knowledge of biological systems and the roles that they play in human behavior, I think that would be more challenging. But because this would be an introduction to that, there would be a point where we say, so the hormone oxytocin is, it assists women through childbirth. It's what activates delivery. It's what's a hormone that's secreted when they breastfeed. And men also experience elevated levels of oxytocin when they interact with the infant. So even if they don't have a deep rooted knowledge or system of information regarding these hormones, the class wouldn't be as such that it would limit their ability to perform well in the course.
Okay. What do you think their group projects are going to look like? What do you anticipate?
The group projects, I hope, would be something that the students would be able to select from one of the 5 modules that we would be going over, and they themselves would be able to create something like a pamphlet or a discussion, like a TED Talk, where they present the information in their own manner to basically show us or show me, the instructor, that they can become creative while also informing people of the issue, since a lot of students in psychology or in different disciplines can learn the information. Sometimes if it's explained a different way by a different person, we have a better way of understanding it.
Okay, great. Do anybody else have any questions?
I do.
Yes, ma'am.
I was actually going to ask about prerequisites, but you jumped the gun on that. So something that is near and dear to all instructors' hearts right now is the fact that we have been forced to go online and may have to do that for the near future. So I know you planned this as a face-to-face course, but do you think that this course could ever work as an online course, and what might you have to change to make that happen?
I think that it could. I myself, even though the psychology undergraduate program is not meant to be an online program, I was able to successfully take physiological psychology and brain and behavior online and got A's in both of the courses because of how the coursework was presented by a certain individual who will be unnamed. Sounds like cat.
Might be.
There are definitely ways that the students could be provided information. There are a lot of videos out there by Dr. Ruth Fieldman, who is one of the primary researchers in this specific field that could be utilized for students. And then there's also, my intention would be to create PowerPoints of some sort and have supplementary reading material from empirical research articles. So even if I was in a classroom showing these PowerPoints, the PowerPoints could be made available online so the students could review them. And obviously, if there's nothing that's included on those PowerPoints, those things would not be included in a quiz, or a student would not be expected to know that. Now, if a student ventured off and decided they were so interested and wanted to learn more about it, then my hat's off to them.
I have one.
Dr.
know,
West, do you have any questions?
Just because I can. What do you expect will be your hardest unit and why?
What is my hardest unit?
As an instructor, what will be your hardest unit?
I think it would be addressing the social barriers for different social classes. Because I know that a lot of barriers are created not because somebody created them, because they were already placed there for them. And having to address them all in an equal way would be difficult. So when I mentioned lack of resources because of lack of education, I can understand, or I can presume a student would say, well, we all go to school, we all have the opportunity. And I would have to say, well, we all do go to school, we all have the opportunity, but that doesn't mean that we all get the same information. And all of those resources are not available to everybody at an equal level.
So Susie, do you think that'll be your biggest pushback from your students, that they don't quite buy into that notion, or are there other issues?
With some of the students that I've encountered as an undergraduate teaching assistant and as a graduate teaching assistant, I have definitely seen, I don't want to say millennial because I'm considered a millennial, but I have seen the entitled student that feels that, my favorite one was, well, why do we have to follow a rubric and do the assignment? So if a student, couldn't grasp that two people of the same age, but one is Hispanic and one is African American, Black, or Asian, or white, they will each experience their own subset of issues, primarily because of their culture and their upbringing. My faith and the way that I was brought up as a Latina and a Hispanic was very, very different from the way that my fiance was raised. We're more collective than individualistic. So for some students who say, well, you can just run out and get something done, that's not really true, because I have to take everybody into consideration when I do something. I can't just say, oh, okay, well, ignore everybody, focus just on me. So I hope that in a way answered your question.
It did. It did. That makes a lot of sense to me. People need to understand, I think you're saying that each individual is going to process a little differently, right?
Right.
Right.
And for example, when I attended school in South Texas, and this is going to make me sound ignorant perhaps, but I didn't know much about American history because we focused on Texas history. So I honestly, I knew about the Battle of the Alamo, but I knew nothing about the rebel flag and what that was. I was like, it's a flag with us, like a, you know, it just looks different. I didn't know the North and the South, and I had no knowledge of that, but because Texas was more focused on the battling between Mexico and America that took place in Texas. And we also, our classrooms were very bilingual, so I didn't have the vocabulary skills that I have at this point. I literally had to carry a thesaurus and dictionary with me during my time at community college because I didn't know what basic words meant. And that was just a limitation to where I literally grew up on the border. So that was a cultural and ethnic limitation of my own education growing up.
All right, any questions from any students of the process? Life? Excitement of being done and moving on? Woo! Yes.
I wasn't going to do it just so I could like fail and stay in school.
Oh Lord, no. All right, I have a suggestion. Everybody take themselves off mute if you can, and let's give Susie a round of applause. Yay! All right, while we're here, if everybody can, if you can, I'm going to take a picture so we can do this. So hold on, everybody. Everybody smile.
Natalia, smile.
All right, you got your picture there.
Yay.
All right, well, good job. Congratulations. Good job, Susie. Yeah, that's great. You
well,
are.
I do hope this is something that, you know, even if it's not possible at UNC Charlotte, it's something that could be possible somewhere, because I was lucky enough kind of begging to attend the training that I attended, and some of them lasted days, some of them lasted a whole week, and the last one I did was last semester and started in August and ended in December. And collectively, last night I did the math, and that was $6,800 in scholarships that I was given. Wow. And a lot of that knowledge and information that I would, you know, contribute to this course comes from that training. And a lot of students, they don't have that kind of money. And that information seems really important to a student who already knows she or he wants to focus in that information or that field as a graduate student. So I feel like a course like this should be implemented almost at every university if there's a need for it.
Yeah, I think it sounds great. You've got it ready. And that's one of the things we want from our students. Tell the rest of you here, for our graduates, we want them to have a product that lets them get out the door, hit the ground running, and use their master's degree to improve their jobs almost immediately. This is definitely one of the examples of that. You're our first student to go through with a syllabus as your capstone. So you did a great job, Susie. Good job. All right.
Well, thank you. And I got a lot of really great advice from Dr. West and Dr. Van Wallendale on how to format and structure that and what to include, what not to include. So I appreciate both of your help there. It's meant a lot to me. And I do want to say that this is something I'm very passionate about and became very passionate about because, and I'm sorry to embarrass you, when I was a student of Dr. West, she introduced me to a side of the psychological sciences that I had no idea existed. And I actually fell in love with, which was the biological and physiological and neurological processing of the brain that contribute to psychological behaviors. So Dr. West, I do appreciate you being an instructor in my life that has instilled that passion in me. And my hope would be to be someone like that for a student one day.
Yay. That's wonderful. Well, now is the time when we would pass out the cake and eat and sit around.
I have one if anybody wants some.
Yeah, and then like think about heading over to the wine vault and having a glass. We would take all the snacks with us to the wine vault. I'd buy a bottle of wine. We sit and drink. That's kind of the, I mean, it's great to get together everyone here, but it's a bummer that we can't actually take it to the fun part that's supposed to, the community building part that comes up next. But if you don't mind, I'd like to post this, Susie, on our the Liberal Studies Facebook page. And
yeah, and I can send you the slides, I can send you the syllabus, I can send you whatever you would like.
Great. Yeah, send me whatever you send in to Lori for that's so I can save it for the capstone. Okay.
All righty.
All right. Thank you, guys.
Thank you.
Thank you.
Thank you, everybody, for coming and watching.
Good job, Susie.
Congratulations.
Thank you.
Celebrate.
Congratulations.
Yay for you.
Bye.
Thank you.
Bye.